We're covering Colorado first on CBS News Colorado at 6. Colorado insurers say healthcare premiums could increase by hundreds of dollars next year.
Yeah, the warning comes as state lawmakers consider $40 million in new fees on insurers to subsidize care for certain Coloradans. Your political reporter Sean Boyd joins us now tonight. Sean, insurers say they will pass the fees on to policyholders.
As many Coloradans are already struggling to pay their bills. Supporters say without the money, thousands of low and middle income Coloradans won't be able to afford insurance. And the more uninsured there are, the more we all pay. But opponents say a $40 million increase in premiums could also result in more uninsured.
We are in an incredibly difficult position right now, and we recognize that.
Senators Iman Judah and Kyle Mullica went before members of the Senate Finance Committee and asked them to bail out an enterprise that subsidizes care for 176,000 Coloradans on the state exchange and 6,700 undocumented immigrants on OmniSalud, in addition to supporting the reinsurance program, which has lowered premiums across the state. The health insurance affordability enterprise, they say, is short $140 million.
At a time when immigrants' access to coverage and rural access to health care are under attack nationally, Colorado must lead in ensuring that health coverage and health care remains accessible to all.
A bill by Judah and Mullica is aimed at doing that by allowing the enterprise to sell $100 million in bonds and assessing a $40 million fee on the state's 5 biggest insurers.
This fee is going to be passed on to, again, everyday Coloradans, employers, small businesses, etc., and that's going to drive up costs.
Kevin McFatridge, executive director of the Colorado Association of Health Plans, says insurers have already paid more than $700 million in fees to support the enterprise over the last 6 years. If the bill passes, he says premiums for some families could go up by another $500 per person per year. Meanwhile, Senator Barb Kirkmeyer noted the undocumented immigrants on OmniSalud pay no premiums.
I'd like to know if you think that everybody should at least pay some insurance premium.
I think that health insurance should be affordable to everyone, and so I don't think that that means that everyone should pay some type of premium.
Several members of the committee also questioned whether the enterprise should take on $100 million in debt by selling bonds for a 1-year fix.
We're creating bonds, taking a loan to pay for our costs for this year, but we don't know where we're going to be next year. Why aren't we cutting costs this year?
Bill sponsors and Insurance Commissioner Mike Conway say they're working on a long-term funding source, but without the bill, they say, thousands of Coloradans could lose coverage due to cost.
These are people, and they matter. And them being able to have access to health care matters.
It matters to a lot more people than the ones who are receiving these benefits. It matters to the people who we have to go and explain to why their insurance could go up by $500 a year.
Senator Kirkmeyer also warned that under the Taxpayer Bill of Rights, any entity paying a fee must get some benefit from it, and it's questionable whether insurers benefit from this one. She says the bill could result in a lawsuit that could jeopardize the entire enterprise. You know, well, most of these committee members did express concerns with this bill, passed on a party line vote, and is now headed to the full Senate.
And the debate will continue. Thanks, Sean.